And welcome everybody to the 2024 World Pancreatic Cancer Day webinar. We have a preview of the campaign. We do have a little bit of background as we typically do, and we will go through all of the background and all of the assets and a lot of kind of instructions as we move toward November and toward World Pancreatic Cancer Day on the 21st. Also keep in mind that we this year this presentation is in the middle of September, which is new. We were informed by a lot of our members last year that they wanted to get access to the creative elements earlier so they had time to work with them. And so we've made that change. So without further ado, I'm going to introduce Carrie McKean-Kelly, who is the WPCD committee chair. She is also the founder of Kelly's Heroes Fighting Pancreatic Cancer. And this is the 5th year that I have had the pleasure of working with Carrie as an active member of the committee, and it's her 2nd year as the chair. And so thank you again, Carrie, for your leadership and for all of your great work on this campaign. I'll turn it over to you.
Okay, thank you, Craig, and hello, everybody. Good morning, afternoon, evening, wherever it is in your corner of the world. Really excited to be here with all of you again, sharing this year's campaign. We have a wonderful committee working on this all year round, under the guidance of the creative guidance of Craig and Evan. And I will just say that, you know, for us, Kelly's Heroes, we're based in New Jersey, a very small grassroots organization, and I'm just so appreciative to be part of this coalition and have the collaboration with all of you worldwide. It's very inspiring. So we're excited to share what we've come up with. We've got a fresh look. We have a campaign that's more mobile focused, and I think most importantly, we are really leaning in this year's campaign to the global nature of this coalition. We have more assets than ever before that are designed to reach a broad audience of people who need to receive this life-saving information. So we're really happy to share it with you and get any feedback that you may have. I'm going to turn it back over to Craig, and he's going to take us through the beginning of the agenda.
Right, and thank you, Carrie. And also, just as a note, anybody joining who has joined in the last few minutes, please mute your microphones so that we don't hear any of the background noise from where you are. So we do have a lot to cover today. We've just kind of done the welcome introductions, although I did realize that I didn't introduce myself. My name is Craig McCanch, and I am the founder of Native Marketing. And we have been working with the World Pancreatic Cancer Coalition now this is our 5th year, and have worked with different groups through our committees over the years, but we always seem to leverage the input from around the world to come up with the best campaign each year. So we're ready to go. We are going to take you through how we refreshed the Hello Pancreas theme for this year. We're going to show you the logo and a lot of the campaign elements. We got some surprises on the campaign videos, which we'll talk to you about in a second. And we're then going to go through what we have in store over the next 2 months, 57 days to be exact. Some of the things that you can specifically start doing now, and then we'll have time for Q&A. But we always want to recognize and thank our wonderful sponsors, Astellas and Novartis. It is through their generous support that we're able to continue the work of the coalition. And most of you probably already know about these two great companies, but they are also featured on our website, and you can check them out in the sponsor section of the website. Just really quickly, as a reminder, we are recording this session, and we're going to make it available on the email that comes out tomorrow, which we'll talk to you about more in a minute. Please feel free to keep your cameras on, but we definitely want to keep your microphones muted. And then at the end, we can ask questions and go over any specifics that you might have based on what you see today. And I'll turn it over to Carrie to talk about our target and our goals. You're muted still. You're muted still, Carrie.
Sorry about that. When we start on a campaign, it begins really with identifying and knowing your audience. And so the committee felt that it was important to stay aligned um, in developing these resources with these key audiences in mind. Not much different than what we've done in the past, but our primary audience is really the global general public. You know, the global nature of this coalition, we need to reach everybody across a broad swath of the globe, really. Secondary audience is anyone touched by pancreatic cancer. We know they are tuned into the message and they're a key audience for us. And then that tertiary audience, the influencers that are in healthcare, science, public policy sectors. We have some actions that we will hope they would take based on our information, but then they also become those trusted messengers that carry our information forward to their followers. So we are
And
moving a
did you
little
want to
slow
roll
and
into the
getting,
goals, or would you like me to roll into those?
yeah, no, I'll go into the goals. I was just waiting for the slide. It was, I don't know if it was for everybody. It was definitely moving slow onto my screen, but we're there now. Um, so for the goals,
Ah, gotcha.
got it? For the goals, we are continuing to focus on introducing the pancreas so that people have this baseline information and it kind of just prepares them to receive the rest of the information that we want them to learn. Our second goal was to refresh the creative elements and assets to increase the conversation leading into that information about symptoms and risks. The creative refresh is really intended to grab people's attention. We wanted it to look quite different from the Hello Pancreas campaign that they saw last year. And then thirdly, we wanted to expand awareness and increase engagement with more video. And as you will see from Craig very soon, we've been quite ambitious in that regard with this year's
So,
campaign.
okay. So, 2024 strategies, given the goals that Carrie outlined from the committee, um, the number one thing is that we will be refreshing the logo and the theme, but we also this year are going to refresh the symptom and risk icons. We feel that people have gotten used to the same design over the years, and so this year we are going to make those stand out and be a little bit more bold. And speaking of bold, that is a big part of our campaign look for this year. We want to be bold because it is a disease that's very devastating, but we can still bring some boldness and some brightness to the messaging and to the design to help us stand out in the marketplace. We also want to, as Carrie mentioned, lean into the mobile lifestyle. We had really great success when we switched the video from horizontal to vertical. And so we're going to take more advantage of that this year. And then finally, we wanted to make it easier for everybody to have access to materials that were pre-designed and pre-translated for you to use as we go through it, that we have many elements that are going to be in 20 different languages. So as you remember, last year we launched the Hello Pancreas theme, and we used the idea of a chat or a conversation of people talking with text bubbles. Well, in 2024, we wanted to make the theme and the logo even more simple, and we decided to use the universally recognized um, emoji for saying hello, a waving hand. And so this year's logo, which you've probably seen in some of the earlier messaging, is Hello Pancreas with the waving hand. And we, of course, also have a version of the logo that is the straightforward Hello Pancreas logo. We then have the World Pancreatic Cancer Day, 21 November logo lockup. And for those of you who wish to help us celebrate the 10-year anniversary, we also have a version that incorporates the number 10 and 10 years raising awareness and hope. Of course, we want to make sure that we also have the logo to work on light colored backgrounds and dark colored backgrounds. But I think most importantly, as I mentioned a few minutes ago, we are producing the logo that is going to be easy for you to just download and use in your own local language, completely built out. So those folders will be on the website for you to download in October. So I'm going to turn it back over to Carrie now to talk about the key campaign messages.
Yeah. Thank you, Craig, and sorry you guys for those glitches before. I'm going to stay off camera just to so we're not using up so much bandwidth, and hopefully things stay on track. Um, so key campaign messages. Again, we need to talk about this important organ, what it does, because I mean, I think you've all had experiences talking to your communities where people don't even know what the pancreas is or what it does. So we start there with our key messages. From there, we want to connect people with the symptoms of pancreatic cancer. And that's what happens when your pancreas stops working. Um, that is the place where we begin to kind of move into how people can pay attention to that and become active in their own health. Third, we want to provide guidance about what you should do if you happen to experience those type of symptoms. That's the information where we want to guide people to take action. And then finally, a key campaign message of reinforcing that this is a very deadly cancer, unfortunately. It remains an important message because knowing that it's one of the leading causes of cancer death worldwide is what gets attention and what really convinces people that we need to do more. So moving over to some of the campaign elements that we've seen some previews of, new icons as Craig led us through. Other deliverables that are going to be coming your way are a poster. We have all of these updates and all of these resources on the website in more languages than ever before. We have the video package that Craig is going to preview for you soon. Very robust package of social media resources for us all to use with our followers, and then the guides and supports, you know, the Turn It Purple guide, the media outreach resources, and all the other tools that just hopefully makes your life a little bit easier during this busy time.
Great. Thanks, Carrie. Yep. And so let's jump right in. The first slide is to show you the upgraded um, design for the icons for symptoms. As I mentioned, that for after 4 years of using just kind of the purple and white look, we really wanted to make them more bold and so that they stand out in kind of the very dynamic marketplace of the internet. So here are the new symptom icons. They're the same names, same symptoms, by the way, but just different look. And then we also redesigned the risk icons to fit. And these also, as you'll see throughout, use the new kind of the color palette for the campaign. Next up are the flyers or posters. In the past, these were 11 by 17, but with guidance from all of you, we changed them to smaller A4 or 8.5 by 11 inch size. And they feature the new look and information about what a pancreas does and what the symptoms might be for when your pancreas stops. And as always, these will be available in Illustrator version so that you can do any translation that you would like to do and add your logo to it to print out. So what we're really wanting you to do is to please print these out, hand them out at events, take them to GP offices in your area, send them to the press. You'll have them as a PDF so they're emailable around. Try to get these out into your community so that folks are using them and learning about the pancreas and about what it means when you see the symptoms. The new campaign look and feel will also be integrated into our website, which is still at worldpancreaticcancercoalition.org. But because that is such a mouthful when you're trying to tell somebody where to visit, we will once again be using hellopancreas.com as a short version of the URL. So when you're talking to somebody on the street, you can just tell them to go to Hello Pancreas, and it will automatically take them to our main World Pancreatic Cancer Coalition site. And of course, just like last year, we were able to purchase a number of different local languages of hellopancreas.com. You see the ones here, but we, I think, have now 11 or 12 total languages using the words Hello Pancreas. So when we send you a link with something, for example, on a video, and if it's in Italian, the link will go to ciaopancreas.com. And the same thing with the advertising that we do, it will go in the local country to that local language. And so the other thing that I'll show you is just a look at how the animation looks on the website when it launches in October. People will go to the website to Hello Pancreas and they will see just an intro animation that launches the campaign. And then from there, they can pick any of the different top navigations about the pancreas, Hello Pancreas, symptoms and risks, time for action, and downloads. Of course, we also will fill in this whole section of the website with the graphics from this year and the look and feel so that it's a cohesive campaign. And we're also going to be adding again this year the create your own social post feature. And we really do hope that people take advantage of this and use it. It's going to be it will allow anybody on our website to create a social post that's customized for them for Facebook, Instagram, and or X Twitter. It's available in 20 languages and it's really, really easy to use. Once somebody clicks on the Start Now button, they're presented with a very step 1, 2, 3, and 4 grid. Pick which platform you want to design for, choose your language, upload a photo, and then answer the question, how will you raise awareness for World Pancreatic Cancer Day? All of that will automatically get built into that template that you see on the right. And when you click the share button, it will automatically take you to the platform that you chose and post it on your local social media platform. So it's super easy. I encourage you to, after this is launched, to go ahead and play with it yourself and make some posts on your own and then share it with others. One other thing on the website this year is that in 2024, we've now launched our 6th language. We've had everything up until Portuguese. So we added Portuguese language this year. It was, I want to say, close to 300 million people in the world speak Portuguese. So it made sense to add this as a new language for the website. And the main part of the website has already been translated and is live, but the World Pancreatic Cancer Day section that you just saw will be launched later this month, or sorry, later next month. Okay. So let's talk about video now. Video is becoming obviously crucial for online advertising and online awareness building. And this year, our committee, which is made up of an amazing group of coalition members from around the world, they really helped guide us to make the creative look and feel of the campaign as global as possible. Because pancreatic cancer is such a global challenge, our campaign will again really shine a spotlight on the global impact that the WPCC is making and can make in awareness raising. So we're going to have a global cast of characters, as you see here. They are going to be featuring people who are both young and old, men and women, people of color, people from different nationalities. And each of these people will be a star in one of the videos. And so the fact that we had success in our vertical format from last year, as we mentioned, we're going to continue with that in 2024. One of the big changes is that we probably all realize this. There's a shortening of attention spans and there's a need for novelty. Everybody wants something new all the time. And so this year we've created 9 separate individual short videos that dissect our message and tell a little bit of the story, each using one of these stars. And we feel that this really represents the best way to create additional engagement and to continue to spread awareness. So each video will always deliver the Hello Pancreas theme, but each one will feature a different cast member and they'll each talk about something different, whether it's a pancreas function, the symptoms, what does early detection look like, what steps can you take to advocate for your health, etc. And then each video will end with a call to action that supports the campaign. So we're only going to show you 3 of them today. We are actually in the middle right now of translating all 9 into the 12 languages. So I have 3 that I'll show you in English. And so let's look at the first one. Okay, that was video number one. And the last video. So once again, we will be translating all 9 of the videos into the 12 languages that you see on the screen. I think it's important that with more video options that we're able to continually refresh our campaign message over the 21 days of November. The video will be ready to launch on October 31st US time. We would encourage everybody to wait until November 1st to share it, share them. But please do share. And then if you have a need to edit the video, that if we, A, if we don't have your language, or B, if you would like to add a logo to the end of the screen, you can reach out to us and we will provide you with a Premiere Pro fully editable version that you can use ahead of time. So that's the video section. Um, Obviously, because social media will be such a big part of the campaign this year, we still have all of our primary social media platforms, but you may remember that we launched on TikTok this year in January, and we are growing followers rapidly, and we are actually getting lots and lots of views. So if you're on TikTok and you're not following us yet, please do. TikTok at World Pancreatic. And these videos are all going to work really well on that platform, as well as on Instagram and Facebook Reels and Stories. And so one last thing on social media is that we will be providing you with a lot of static social media assets that I'm going to show you in a minute. And that we're also going to do a paid social campaign like we've done in the past in 5 languages, but it'll stretch over to 10 countries. So there'll be some paid posting on Meta as well. Okay, so I'll just take you kind of quickly through some of the creative elements for social media. This is an example of the cover image for Facebook, Twitter, and YouTube. They all look a little bit different, but they're pretty close to this. And so what we really would like every one of you to do is just download this and make it the cover image for your organization's website or for your organization's social media page, as well as your personal social media, so that we are continually and kind of cohesively using this Hello Pancreas logo and look for next year. We are providing you also with profile images that you can use to insert your picture, as well as just use the Hello Pancreas logo. But again, encourage you and your family and friends to use these, because the more people who are sharing the same look, the more impact the campaign will make globally. An example of some of the static social media posts that we'll have posting from our accounts will be the risks and symptoms social posts, and then we have fact-based posts about the 5-year global survival rate for pancreatic cancer, and as well as the fact that it's the 3rd leading cause of cancer death globally. These are just a few examples. But one of the important things, similar to the logo being made available in 20 languages, we are also going to make a key social media post pre-translated into 20 different languages that will be available for you to simply download. You can add your logo to the bottom next to the Pancreatic Cancer Coalition logo or not if you want to make it easier. If anybody is using Canva, Evan has also made a Hello Pancreas campaign template for Canva, which will be made available to everybody. And you'll be able to use the look and feel of the background, but put your own language and your own message onto those. So please take advantage of this. It's now very easy for you to use. And like I like to say, there's no excuse not to use one of these social posts. Another piece that we think is a fun way to share the message is download this smartphone wallpaper and add it to your smartphone so that anytime you're out in the month of November and you answer your phone or your phone rings, this image will pop up and you can show it to people and say that you're supporting Pancreatic Cancer Coalition and the fight to end and to find cures. And so that's something that will be important as well. And then the other elements that Carrie did mention are all of the guides and support. Some of these have already been sent out to you. The campaign planning guide you should have received via email and the Light It Purple guide. But there's 5 or 6 other guides, including how to use the key social post guide, the key messages guide for this year. And of course, we also want to have this year an updated version of the guide for patients to use. With such a high percentage globally of late stage diagnoses, the committee really felt that having this type of a patient guide could be a tool for earlier detection. So by letting this get out to the world and people can download it, check the boxes that make sense, fill in the information, and use it as a helper when they go to their doctor to talk about their problems will certainly make a big impact. So that's kind of the end of all the guides and the creative pre-made elements. But as we have done in previous campaigns, all of these photos, colored symbols, arrows, waving hands, the shapes, the people, all of these will be available as individual assets so that you can design your own materials for use in social media or posters or any of the other elements. We've also included in the brand guide a complete listing of all the colors and all of the hex codes that are used. So if you're doing anything on the web or anything on a design tool, you'll be able to immediately get those colors. And then that really takes us to what we can all be thinking about to do over the next 57 days. And the most important thing is to look tomorrow, you all will get a newsletter. And that newsletter will look like this at the top, but it's going to be a long scrolling newsletter. And below this part will be all of the links to all of the assets, or to not all, but many of the assets that we showed you today, because not all of them are quite ready for releasing yet. But you'll have access to a lot of the logos and assets. So download these, download the flyers, and start figuring out how to best use those in the campaign. The other thing that you can do is to start reaching out and talking with any local media influencers that are in your sphere of influence and let them know that the campaign is ready to be released. Send them some of the teaser information and let them get started on that. Another thing is to share, I'm sorry, whoever's got their video unmuted, please mute your video if you could. Thank you. So on November 1st that's when we want you to start sharing the new campaign videos. Share them often, share them widely, share them on all of your different assets. And then of course, as you're getting into November, use the hashtag WPCD and hashtag Hello Pancreas hashtags so that you can continue to reinforce. And by the way, if you see stuff from WPCC posts, like them, tag them, share them, and we will continue to do the same of your posts so that we can make kind of a more unified global push. And then of course, lastly, on the day, wear purple, light it purple, and really use our global sphere of influence to spread awareness and hope. And
All
I'll
right.
turn it over to Carrie. There you go.
Yep. Thanks, Craig. So this here is our call to action. These are the 3 things that we would ask every coalition member at a minimum to do this November. So first is sharing all 9 of those videos beginning on November 1st. As you've seen, they're very short. And if you combine the 9 of them, you're sharing a lot of really valuable information with your followers. So we ask you to do that. Number 2, please use the WPCD logo and those key social media posts that are available in your local language. And as Craig said, engage with the WPCD social channels. Um, you know, use those core graphics that have been prepared for you. Use those hashtags so we can knit all of our posts together and see the big broad impact, and like and share from the WPCD pages. There is no easier way to get good content out there than by just hitting share. So we ask you to please do that. And then we just can't let this webinar go by without acknowledging the work of this committee. They're very creative, they're very insightful, and they've put together something that I think everyone is going to be able to use well. So shout out to Louise Lohman from Pancreatic Cancer Action UK, Louise Ellis, Pancreatic Cancer UK, Lisa Frame of Let's Win, Francesca Mella, Associazione Nostra Viola in Italy, and I'm sorry if I'm butchering that. Maria Reze Skarivic of Love Love in Israel, Iga Rawika, longtime member of this group, Europa Colon in Poland, Helen Wright of Craig's Cause in Canada, and then Allison Lewis from PanCan. So thank you everybody for shaping this campaign and putting your imprint on it.
Yes, thank you all very much for that hard work for this year. And I apologize for the quirky internet action going on today, but we will do our best to kind of edit a clean version of this video for anybody who's going to get to see it later. But for you all, you are our test pilots, and so we thank you for bearing with us. If anybody has any questions, you can go ahead and put them in the chat um, or in the Q&A if you have that on your Zoom. I'm not able to see any raised hands, so if you are raising hands, that will be a challenge for me. So it's best if you use the chat. And if you don't have any questions, no problem either way. Like I said, this will be available as a recording tomorrow, along with all of the assets. And that is, we'll just keep motoring through. If any questions come in as we're trailing off here, we can try to address them. As always, once again, let's say a big thanks to our sponsors. The coalition really couldn't do the work that we do without Astellas and without Novartis. So thank you guys very much. And thanks, of course, to all of you in advance for your commitment to helping us raise awareness again this year for the 10th anniversary of World Pancreatic Cancer Day. And I know all of you who are on this call very likely have some very close personal connection to this disease and or to a family member or a friend or a relative who's been touched by pancreatic cancer. So let's do our best to download these materials and really go ahead and use them to make this the best campaign ever. And it looks like we did get one question that came in. Did I understand correctly that you could provide materials so we can translate the videos ourselves to the languages that you had not translated? And the answer to that is yes. If you just want to send an email to info@worldpancreaticcancercoalition.org, that very long email address, info@worldpancreaticcancer, or to info@native-marketing.com. We will get a link, and it's a huge file or a huge set of files. So we'll have to set up a Dropbox for you to download from, but yes, we can make that available. And let's just give one more second to see if there's any other questions that pop up. But anyway, as I was saying, we have the tools this year. We have the logo pre-translated into 20 languages. We have the social post translated into 20 languages. We just ask that you use as much as you can, sorry, use as much as you can of the materials to try to have a really globally comprehensive campaign. But other than that, we can let everybody go. Carrie, thank you for your companionship and support throughout this process and your leadership on the committee. Bye, everybody. Thank you.